Thank you, Nancy, and certainly good afternoon, everyone, and welcome out to what should be a valuable conversation. Good to see so many familiar faces in the crowd, or as time goes on, so many familiar masks as well. But it's all part of it. At this time, I'd like to acknowledge that we are Mi'kma'ki, the traditional territory of the Mi'kmaq people. I would like to also acknowledge that people of African descent have helped shape the history and the culture of Nova Scotia for over 400 years. I'm so pleased to be here this afternoon for this wonderful conversation, and it's so important that we share them with our health leaders. These are important discussions to have. I'm pleased to welcome MLA and Health and Wellness Minister Michelle Thompson, and of course Michelle will be providing an update on work underway to improve our healthcare system. Joining us as well, to my immediate left here, is Brett McDougall, Nova Scotia Health Vice President of Operations for the Eastern Zone, and Health and Wellness Deputy Minister Jeannine Lagassé is joining us as well, to Brett's left. Thank you for joining us for this community healthcare conversation. It is very important, and with that, I'll pass it over to Minister Thompson for a few words.
Hello. Okay, great. Thanks. Hi, everyone. I'm Michelle Thompson. For those of you who don't know me, I will admit I see a lot of familiar faces in the room today, former colleagues, and so it's going to be hard to be anything else but myself here today, or they're going to tell you that it's that I'm not. So I'm very grateful to be here, very grateful to be the MLA for Antigonish, and very grateful to be part of this group that's traveling around the province, because we do want to have conversations in communities about healthcare. We know that it is one of the most singularly important issues that Nova Scotians are worried about, and certainly when we were elected last year, that was what resonated with Nova Scotians. So there has been a lot of work underway, and we're going to talk to you a little bit about that work, and certainly open to your questions and your ideas as well. So I'll just give you a bit of a summary. So after we were elected, it was very important to the Premier that we travel around the province and we speak to healthcare workers. And so we did that last September, so September 2021. For 4 or 5 days, we traveled throughout the province. Our car started in Neils Harbor, and we ended up in Yarmouth, and then we settled back in Halifax. So I think each vehicle did about 25 or 2,600 kilometers in a 3 or 4 day period, and we had great opportunity to talk to healthcare workers in particular about things that they felt were important, the changes that they had experienced that they felt needed to be addressed in order to improve healthcare. And those voices are what informed our healthcare plan, which is called Action for Health. And so you can Google that if you want. It talks about the Action for Health plan and the different pillars that were identified through those consultations. And to accompany Action for Health, it was also really important for us to be accountable. So we wanted people to have the information about how we were progressing. So in addition to the pillars that are there, you'll also find that on a regular basis, quarterly, sometimes annually, depending on what the metric is, that we will tell you how we're performing, where we're improving, and sometimes we'll be admitting that maybe there haven't been full improvement yet, but you'll understand what the actions are that we are taking. And we also have a daily dashboard which looks at the day prior and tells you what was happening in the healthcare system. So that includes the number of emergency room visits, number of surgeries that were performed, just different information. And it should never be used to inform your healthcare decision. Like, we never want you to go to that dashboard and decide whether or not you're going to seek healthcare services. Rather, it is an opportunity for you to see what's happening, and you can see trends over time. That's what's really important about that. You can see where we're trending up or trending down. So accountability is really important. For a long time, information often comes one way, but it hasn't always gone back. And so it's really important for us to find different ways to send information back to communities and to Nova Scotians about what's happening. And that's the reason why we're here today. We want to tell you about what's going on. We'll be, truthful. We'll tell you there may be some things we can't say right now for different reasons, but we will be as honest and transparent as we can about the things that are happening. So that's the point of today. And certainly we'll have an opportunity to talk back and forth. So I just want to share a little bit. Our biggest issue that we're facing right now is really human resources. It is the workforce. And I think for those of us who've been in healthcare for a while, we anticipated that there would be workforce challenges, and we knew that. And that certainly is what we're seeing. So we do know that primary care providers, as an example, not just family physicians, but also nurse practitioners, we need more. We certainly need more nurses in our healthcare system, across the system, not only in acute care, but also in continuing care. And certainly we've been working to also improve the CCA workforce, as an example. Allied healthcare workers, you know, for those folks that came from the world of diagnostic imaging and lab services, we know as well that there are some challenges around that. And as a result of that, we opened the Office of Healthcare Professional Recruitment with a really keen eye on how do we increase the number of training seats, number one, and we've done that across a number of professions. Number two, internationally educated graduates. So sometimes those are people that grew up and lived in a different place and want to immigrate to Canada, but sometimes we have Nova Scotians who have trained in other parts of the world as well. We hear often maybe somebody trained in Saba or maybe somebody trained in Britain, and they want to return home. And so we need to make sure that there's opportunities for those folks, particularly the people that study in medicine, to have residency seats. And so we are working with the matching service for residency seats to make sure that there are opportunities, not just for people to move to Nova Scotia, but also for people who are trained outside of Nova Scotia or outside of Canada to come back and work here. So that's some of the work that's been happening. We also know that there's a significant gap as well in our paramedic workforce. And so we've been working very closely with paramedics, the paramedic union, the college, the Department of Health, and Nova Scotia Health to look at how do we support paramedics in terms of their work-life balance, as well as some of the system issues that we're facing. And so I do want to assure you that there's a lot of work underway addressing the work around paramedics and our EHS services. Recently, in the past year, since we were elected, we've changed, as an example, we've tried to split the emergency calls from the transfer calls, which is really important. And historically, paramedics have done those for us, but we separated those two services. And as a result of that, in September of 2021, 86% of the transfers in this province, low acuity transfers, were happening with paramedics, and we've reduced that now to 22%, which is a pretty significant change and improvement in the service. Our goal is to get to 5%, and how we do that is by working with the paramedics, the people in the field, working with the company, and understanding how we provide the right care so that people can be transferred and allow our very well, highly skilled paramedics to respond to emergency calls. I have a few notes here so I don't miss anything, so I just need to make sure I'm following along. So again, responding to the healthcare professional shortages, I was also really proud to be part of the government that increased the pay for continuing care assistants. So in the fall of last year, we were able to increase CCA wages, which is really important. And that was a really difficult, those are difficult positions to fill. And so certainly in my experience from working at RK McDonald, we had a hard time recruiting people to that program. And, we had a lot of tricks up our sleeves, but we really were struggling. And I know a couple of years ago, there was less than 15 graduates, as an example, from one of the local Nova Scotia community colleges, which certainly didn't meet the needs at RK or other long-term care facilities or community-based care. But there's over 1,000 people registered in that program in September and working through that program, in addition to long-term care facilities that are now training their own CCAs through a prior learning. So we're really proud of that. It's very, very important for us to have a strong workforce in our continuing care sector, and so really happy about that. I talked a bit about hiring those non-paramedic drivers, which has been really helpful for us. In terms of addictions and mental health, so really looking at how we can improve access to care for folks experiencing mental health issues. And so there have been day hospitals that have been set up through the province, and they have been very, very effective. And we also recently Minister Comer, Brian Comer. He's a registered nurse as well and has a background in mental health and addictions. And he's been working very closely to look at how we can support 24/7 access, particularly in rural emergency rooms and primary care providers supporting people experiencing mental health crisis in our rural communities. So there's a lot of work that's underway in regards to how we support people living with mental illness, and that's been high on the radar. For the first time, they have their own minister, which is really important too. He's able to move some things forward as a result of that, and of course now there's also I'm a little bit disconnected in a way from seniors in long-term care because they also have their own ministry. So Minister Barb Adams is a physiotherapist who worked in long-term care for a number of years, and she's the minister and been working really around how we increase the number of beds, what supports we offer seniors in community, increasing and trying to strengthen the workforce as an example. So there'll be lots of time for us to talk about different things, and you probably have lots of things on your mind. So are you going to speak, Jeannine? Okay, yeah. So I'm going to turn it over to Jeannine. This is my first one. I'm in the legislature right now, so I missed the first two, so they're going to have to push me along and tell me how this all rolls. So anyway, I'll turn it over to Jeannine.
Thank you, Minister. I just wanted to thank you very much for welcoming us into your community today. And I was at the sessions last week. We were in Windsor on Wednesday night and Truro on Friday night, and just had a great conversation with the communities there. And that's really what we would like today to be, is to some of the questions, as Nancy said, we've received in advance. Some of them we will take from the floor, but really just want to have a conversation with you so we can hear from you what your concerns and solutions potentially are for your own community, and for us in answering your questions to give you some information. So just thank you very much, and I look forward to the conversation.
Hi, good day, and thank you. My name is Brett McDougall. I'm the Vice President of Operations for Nova Scotia Health for Eastern Zone, so that's Antigonish, Guysborough, and Cape Breton. Spent many a day walking the streets here. I have 2 degrees from St. FX, and love Antigonish and the surrounding communities. I am here filling in for our CEO, Karen Oldfield, who's unfortunately unable to attend today, so she sends her regrets. But hopefully myself and a number of my colleagues and team here who are at a number of the tables in the back can help answer any questions that may have a local context. So I look forward to the conversation, and we'll see where it takes us. So thanks again.
Okay, thank you. And I too had the opportunity to participate in the other sessions, and we tried to keep them as comfortable as possible, so as informal as possible. And what we'll do is I'll start reading some of the pre-submitted questions just to give us kind of a flavor and let the healthcare leaders at the front have an opportunity to answer a couple, and then we'll move to the audience and alternate back and forth. And like I said, we'll try to get to as many questions as we can throughout the afternoon. So this first question actually I think fits with some of the introductory statements that were already made. And it's specifically around recruitment and retention of nurses. So the question is, I'm interested to know what going forward you are doing for recruitment and retention of nurses.
Great. So there's a couple of different things. So in terms of recruitment, we talked about the seats, so the number of seats that we have. So first of all, that we need to grow our own workforce as one strategy. So we did increase the number of seats in the province by 200, 80 registered nurses and 120, and we worked very closely with the universities and the community colleges to do that. Now we know that's more of a long-term process, right? Making sure that people are into those programs and getting a solid experience and ready to go. We've also looked at internationally educated nurses. So looking at the way in which you register in the province has been really important. So we won't be able to catch up by just simply growing our own workforce. We're going to need to have people come and work here. So whether they come to us through, in migration from other provinces, or if they come to us from other countries. And so working very closely with Labour Skills and Immigration, but also the colleges around how we license nurses. And if you are a registered nurse, how do we very quickly close the gap And there have been a number of nurses in the province for a number of years from other countries who just simply weren't able to register for a variety of different reasons. And so through that work with the college, we've been able to streamline that and really understand how best we can get folks to work in the profession that they want to work. So some folks will come in, whether or not they become registered nurses, they may have an opportunity to work as an LPN or CCAs, and making sure that there's a clear ladder for people. So if they start, they can then over time transition to the level of education and attainment that they had prior to moving here. We do work very closely. I know Janet Hazelton attended the meeting in Truro on Thursday, and so we are working very closely with our colleagues in the unions to understand not only remuneration, like I know we talk about money all the time, but we really need to look at work-life balance and how we support nurses. Some of our gaps would be around critical nursing as well, critical care nursing, so emergency room nursing, very specific. If you're, an operating room nurse, as an example, those are very specific skills, and so making it easier for folks to be able to work in those environments and get the education and the training that they need. Is there anything you want to add, Jeannine?
And I can't remember, I don't think you covered this one, but we've also last year, out of last year's graduating class, the Premier made an announcement that all members of the graduating classes from our Nova Scotia nursing schools were offered a position upon graduation, and that will continue going forward. And then I think at a really practical level, the Health Authority and IWK have been working very hard on streamlining their procedures for people just trying to get into the system. That we've heard on many occasions that that's a barrier for people, is they can't even applying and getting into the system is very difficult. So a lot of work is underway also from an administrative perspective to just facilitate getting people into the system as quickly as possible.
Yeah, just in addition to that, we have an interprofessional practice team within Nova Scotia Health, and represented right across each zone in the province, and they work along with any of the international graduates who are looking to be employed within Nova Scotia Health. So they help to do an assessment in relation to where their education experience, along with the college, as sort of a baseline for each individual, and then they create a bridging program to help them transition into meeting Canadian standards in relation to nurse education requirements. So it's really a collaboration of the province, a number of organizational bodies and government trying to improve and increase access to workforce for registered nurses, licensed practical nurses, and other healthcare professionals.
I just would like to say as well, just to finish, there's so much work right now in healthcare, and often we hear about the hard things in healthcare, and if you have someone in your life that's wondering about what type of career, I always put a plug in for nursing. Nursing has been a wonderful job for me and many of my colleagues in the room, and really, there's so many opportunities, I think, for young people today, and just trying to understand what that could possibly be. And every time we recruit and we fill more positions, work-life balance gets better and better and better as those vacancies fill. And I feel it's a very, very meaningful career to work in healthcare, and to encourage people mid-career, young people in our community. It really is a terrific opportunity and lots of work, and it allows us to keep people here and keep people home. So we have competitive wages. We're healthcare is where it's at right now, is what we kind of say. And so just to encourage people, and if you have someone a healthcare worker in your life, give them an opportunity to talk to a young person about all the opportunities that there are in healthcare right now. So each of us can be a recruiter, is what I would say.
Thank you. So one more question from the list, and then we'll pass it over to the audience members. So this question, I'm going to read it in the first person as it's written, just because I think it'll make more sense than me trying to translate it. My wife and I have benefited from exceptional service and care from VON for a long time. I would like to hear some type of guarantee that the province will continue and possibly expand their service. What I fear is that some large out-of-province private healthcare business might attempt to try and replace VON in Nova Scotia. Could the health minister guarantee that the VON will continue to receive the support and perhaps encouragement from the government to maintain and possibly expand the service and care VON now delivers?
So first of all, thank you very much for that comment, whoever had provided that question in advance. It's lovely to hear that feedback. I'm only looking at my phone because I do have a couple of stats from our colleagues at the Department of Seniors and Long-Term Care, because I wanted to make sure we were prepared to answer. And they do say that currently 95% of our home care services are provided by VON throughout the province, and is a very valuable partner to the Department of Seniors and Long-Term Care. They also, but they have a very committed relationship. It's ongoing. I think that's, the 95% I think says something in itself. So, definitely a committed partner, and the department is continuing to work with them.
Okay, I like the short and sweet answers that are, yeah, we're good. Thank you. Okay, I'm going to move back. And so in an effort to make sure that we have an opportunity to hear from people, we have, like I said, we have 2 runners with mics. And so if you could put your hand up if you have a question that you'd like to ask, and then we will try to make sure that we're capturing everyone. So, yeah, go to you first.
I'm the service officer here at the Royal Canadian Legion, and I deal with veterans and that issues and that. I have a gentleman named Jeannine who's in hospital. He's a veteran. I fight with Veterans Affairs over getting beds and that stuff, but they will not give him a bed because he wasn't in the First World War, or the Second, or in a special duty area, even though he was, and there's no record of it, the way what place he was at. Is there some way now the health care of Nova Scotia can help the veterans stay into a bed of their own, or get into a seniors complex that was their own private bedroom, because individuals don't like to be around others when they're sick? And this gentleman, Jeannine, he's been a Liberal most of his life, and last year he voted Conservative for the first time, and he said, I know I'll get something done. So I'm hoping that somewhere or another, through healthcare in Nova Scotia, can step up where Veterans Affairs is leaving veterans, not just Jeannine, but other veterans, lay in wait, and that they can't get nothing.
Thank you very much for raising that. We have been working, work had started kind of pre-COVID in working with a number of individual and veterans organization, volunteer organization, in regard to veterans care in general. And so I think that work has picked up over the last 6 or 8 months, I would say. And folks from the department have been meeting with the organization and really trying to understand where we can better interact with the veterans organizations and individual veterans, so that we are providing services and care that are particular for them. So it's a bit more on the primary care side, I would say, than on the beds side of things. But there are, and Brett may be able to pick up a bit on the bed side, but as I'm sure you're aware, there are veterans beds throughout the province. But I can tell you that we are continually working to hear from veterans and their organizations to be able to provide the best service.
Well, Veterans Affairs usually took the beds at Antigonish because they considered there's no veterans left. Yeah. And since there's no veterans left, as far as they're concerned, even though we do have some Second World War vets left around, they pull the beds out and say, no, we don't have beds in the hospital. And there was word that the hospital was using the beds when they're not being used by veterans, which is okay. But somebody in Veterans Affairs leaked out that they were getting charged for it anyway. And it kind of bitter for the veterans, because they weren't able to get the bed, but yet somebody else was getting the bed and getting the care paid for by Veterans Affairs. So they started pulling them out of the hospitals. And I don't know why they pulled them out of Antigonish, because we get veterans from Cape Breton up here and everything, but they've done that.
That may be something we need to get more information about. It's so specific, but we can certainly get back to you about that and find out a bit more detail about it. It's just very detailed. I think it'd be something that we'd have to look into a little bit further. Yeah.
Just if I can jump in, if there's anything specific on the individual person, I know Kathy Chisholm's the site facility manager at the back. If there's any information you can share with Kathy Chisholm as the director and site lead, then we can follow up specifically on that patient.
Sorry. I'm Jim Neary's daughter, and for the last 18 months, I've left my job. I took a leave of absence because I figured my father needed me. My mother is dead. He's going to be 90 years old. He served this country well. My father is a survivor of Nevada, 1957, when the nuclear testing for the atomic bomb was put in Nevada. And my father was there, and he has health issues now. He's been a taxpayer in Antigonish County for the last 50 years, a beautiful farm. Now what we have to do is we want to keep him here in Antigonish, even if it's at the hospital at St. Martha's. I couldn't say enough about St. Martha's. He's been there the last 5 weeks. He had COVID, the worst he could have gotten. He had double pneumonia, and all he keeps asking me every day is, did Michelle get me my bed? Am I gonna be in a veteran's bed? I want to stay home. And that's what we're here for today. I think he served his country. He served Antigonish County. He's been out there. He's been a taxpayer. And he should have the right to stay home, like in a good place. That's all we're asking for.
Thank you. And I know just from having been to other sessions that information for later, I think that is absolutely a conversation that I will encourage you to have. And thank you for sharing that. And I took my mask off because I am far enough away from everyone, I guess, and apparently it's really jiggling, scratchy when I had it on, so I took it off. So I think we'll go to another audience member. Is there someone else that has, okay, over here, it's a question?
Hi, my question is, you have a fragrance-free policy at the hospital, and there's a loophole in the policy in that it doesn't state why there's a fragrance-free policy, that fragrances are actually toxic chemicals. And just last week, a head of a department used that loophole to use a personal care product that had a chemical in it that was masking the scent, and I got severely ill, like 4 days where I couldn't move my body and I couldn't function. And I'm just wondering if you can add at least one sentence to that policy to make it clear that it's not smell, it's a reaction to fragrances, and it triggers a disability whether we can smell it or not. And the disability is MCS, and there's a whole slew of other environmental illnesses that it triggers, including asthma and migraines, etc. And this is a real health concern, and since COVID has started, there's been more barriers for us as a person with a disability, like the extra hand sanitizers and cleaning. And it's about time that we look at the policy again and see if you can add that one sentence so that we don't have department heads using that loophole to use products that are still creating accessibility barriers for persons with disability, with my disability, and at least 1,000 others. Okay, thank you.
We can take that back. Yes, thanks for sharing that. Sorry that you've had to experience that situation, but we can take that away and take a look at the policy if there is a loophole.
Thank you. So I'm going to go back to my list here. And this question is from a nurse practitioner student from Memorial. So I am currently attending Memorial University by distance to become a nurse practitioner. Currently, the Return in Service Incentive Program for NP students targets students at Dalhousie only. Is there any plan to expand this program to students at other universities? If not, what type of support can you offer someone like myself who is having to continue to work full-time in order to get through the program?
So thank you for that question. So currently there is some support that happens in Nova Scotia for people taking a nurse practitioner program at Dalhousie University. But similarly to, we're in a different time, and so this is something that we have taken to the department. We had a chance to see the question before today and look at, how we support and who we support, and if there are programs that are outside the province and they're, meet our qualifications, then, we're going to have a more deep conversation about that. And so we appreciate that. That's something that we hadn't thought about, I think. And so I know that that's gone back. There's a group called the Provincial Nursing Network, and it has folks that are in leadership. It has the unions sitting there, some of the university representation. So we'll take that back, and we'll get back to that nurse that's currently training, because we know we need nurse practitioners in the province. So it's a great question, and it highlighted a gap for us. So thank you.
Great, thank you. So I'll go back to you guys. Are there any other questions from the audience? Anyone who has something that they would like to ask? Just put your hand up and we'll, yep, perfect. I said the other night, I feel like an auctioneer, and you know, excuse my pointing, but that's how I have to direct the.
I'm a nurse at the hospital here, working in critical care. I think you've mentioned some great points going forward in terms of recruitment, which, like you said, can take some time. I'm just wondering what you guys are hoping to do in the short period to ensure nurses are getting vacation, getting adequate breaks, not staying 24 hours due to inability to get appropriate nursing staff.
Thanks for the question. It is a very challenging situation that we're in relation to nursing, for sure. And that's an experience, unfortunately, that some of our staff have felt in a number of our sites in inpatient departments. So, I would say that based on what you've heard in relation to our recruitment, we're going to continue with those efforts. I know CBU has another graduating class coming out in the spring, which is sort of an off cycle in addition to graduates. So we're fortunate in Eastern Zone in relation to having 2 universities with programs in nursing. So we're hoping that can help. But based on your question, I think we're going to have to ask people to do some planning of their own a little bit differently, and that's going to veer away from everyone trying to take vacation in the summertime and try and see if we can provide people with time off throughout the year versus the sort of prime time is what we would call the summertime. So I think over the next period of time we'll have to be a bit flexible as the employer and leadership and with their teams and staff to try and think a bit differently than how we've done it over the past 20 years, just to try and ensure people do get adequate breaks. So it is going to be about sort of teamwork across the teams within sites and facilities, but we're committed to try and support nurses in recruitment, see what other healthcare professionals, whether they're licensed providers or non-licensed providers, to see if they can help in relation to workload. So we have emergency support aides, CCAs, providers that we may not have utilized to the same degree, and sort of increase the complement to ensure that we're taking some of the burden off some of the licensed practitioners. Not sure if that answers your question specifically or not, but it is going to be an ongoing focus for us over the next couple of years. Absolutely.
I would say as well that in a smaller hospital, the group of individuals that do critical care is smaller. And so if there's a solution that the team has, so as an example, if there's something that you've sat with your colleagues and said, why don't they do this? We would really appreciate that. Because what works maybe at Cape Breton Regional is not going to be applicable to St. Martha's, as an example, and what the opportunities are. So, if as a team, there's, and I know sometimes colleagues move maybe to the OR, or sometimes they move to ER, like the critical care nurses kind of tend to move in certain circles. And so if there's an opportunity to do that, I would say too, we have a number of folks who retired and have taken, a break after COVID and a number of those things. And if there's an opportunity for us to lure some of those retired folks back, we would be interested in that as well. So, open to all of the ideas. We need to continue to train and give people opportunities. And the new nurses that come out, it's really important that they're in a supported environment, because the worry is if they're put in somewhere too quickly and they don't feel supported, that we may lose them, not just out of that particular unit, but out of the profession. So we need to be really mindful of that, especially with the 2 years in the pandemic, right? So I think that's the other reason why immigration is so important. So we have, as we grow our own, we have a lot of novice practitioners that come into healthcare. But often when we see people who come to us from a different province or a different country, they're mid-career nurses, mid-career professionals. And so they bring a whole host of experiences with them as well, and so that's why that's such a key move for us to be able to do that. So first of all, if there's a local solution, we would love to hear it if there's some ideas. Secondly is really around that recruitment and hopefully luring maybe some of those retired nurses back and having some agency over the hours that they work. So yeah, thank you. I don't know if we didn't promise anything, I know, but I just want you to know we're aware, particularly like we're worried about the folks that are working a lot, and we know that it's been tough, and we know just coming out of summer especially where with vacations and people needing a break. So I think we're very open to whatever we can do to help.
Yeah, and I would just finish by saying that I'm very privileged. I sit as a member on the health leadership team, and it's myself and Brett's colleague, CEO Karen Oldfield, and the NSH board administrator, Janet Davidson, and Dr. Kevin Orrell, who's in Cape Breton. And I can tell you that we worry about the people a lot, that if you look, as we look at system issues and things that we're looking for new ideas on, people are always top of mind. And I know that's hard, as the minister said, when we haven't promised you anything here today, but I want you to know that we are very motivated, knowing what the workforce has been through, not just in the last 2 years, which have been extremely, extremely trying, but also over the last 10, 15 years, right? And so we just please know that it occupies a lot of the time of the health leadership team, and that's why we are so focused on recruitment and retention. That retention is a big part of this also, right? That we need more people coming in, but we also really need to keep our people that we have, and so looking at different strategies for that as well.
Thank you for that. Get another audience member. Thank you.
Hi, I'm an emerge nurse at St. Martha's. I'm just curious, we all know all the outlying hospitals are 90% of the time closed, from the Strait, Guysborough, Canso. And I know a lot of it is retention and recruitment of physicians and nurses in all those areas. That's not gonna happen anytime soon, let's be honest. What is gonna happen in the meantime? Because we are beyond overrun. We only have so many beds, we only have so many nurses, who a significant amount are actually going travel nursing now, which we are then wasting money on travel nurses from out west to come into ours. So what is in the meantime going to happen, or is there any talk of what are we gonna do in the meantime to help our hospital? Because right now it's 12-hour waits. People aren't getting the care they need. We barely have time to do the necessities, let alone all those nice stuff, right, that we'd like to do to take care of them. So what right now are we doing or plan on doing until we get those recruitments kind of in place to help our hospital?
So I'll start at a high level and then we'll kind of work down into the operations. So there's a lot of different things that are happening. So one is primary care. Primary care is super important. And when people don't feel they have another option, they often will go to the emergency room in order to get the things that they need. So we've been trying to work with a number of test and try models. So we do have now, as an example, nurse practitioners and pharmacists that are able to work together, and we're looking at expanding that model so that if people need a prescription or have episodic care like a UTI, things like that, that we can divert more low acuity but still very necessary things to be treated, looking at how we provide access. In Truro, we also have a virtual ED. So we're not trying to give emergency room like our CTAS 1s and 2s and even some of the 3s. We're not trying to give them emergency virtual care, but we are trying to connect them with access, because really that is the issue. And we know that close to 80% of the people that present to the emergency room actually have a primary care provider when we look at the statistics. So it's not just people, we often think it's the folks that are unattached, but it's actually some people who are attached that can't get in to see their family physician, or it's not timely enough. So there's also, work to roll something out really quickly is often where we fail when we try to go province-wide, because it's just too big, and change management's really important, and folks in healthcare have had a lot of change and they're tired. So we're trying to find ways to make it really applicable and then roll it out and learn our lessons. So working with family practices as an example. Through work in Halifax recently, there was a clinic that felt that they had maxed out, and we brought in a team of people like industrial engineer and people that look at practices and optimizing same day, next day access. And they actually were able to onboard or feel by the time the project's over, they'll be able to take 3,000 more people off of the need of like that list. So sometimes it's really about how does a practice work and how do we support them. So there's any variety of ways that we can give access, because that's the key. They're showing up and emerge as a result of that. And people don't have another option, and that's why they're there. There is a lot of recruitment that's happening right now as well around. We know we have some big retirements with physicians. One just happened with Dr. Michelle Murphy, and we know, Dr. Steves and Dr. Hickey have indicated that so that's top of mind. We know that, and wherever we know that, it allows us an opportunity to, to plan and recruit. So it really is around expanding teams and looking at optimizing, the assets in the community now. And some of those projects are ready to go, and we are working with some local practices around how we can support them in terms of getting more access. And we also have a primary care clinic now, so if you're on the Need a Family Practice Registry, everybody's entitled to have virtual care, so you're eligible for that. And then if that virtual care provider feels that you need to be seen in person, we do have a clinic in town that will actually take you within a certain period of time in order to give you that in-person access. So there's a number of different things. We watch what happens in emergency rooms really closely so that we can try and offload some of your stress. Yeah, you want to talk?
Yes, so thanks for the question. I'm an emergency room nurse myself by background, so I appreciate how challenging it is to work in a busy, crowded, hallways, beds at or near capacity. So certainly appreciate the context there. We are working hard and continuously in relation to how we staff and maximize bed utilization within, I'm going to say, Antigonish, Guysborough. And we are having some success in Guysborough. Once at a time, there was, I think, 12 months ago, we had one physician in that facility, Dr. Jeannine, who was providing coverage there. We now have 4 physicians in Guysborough helping to stabilize care there, and not only being able to see patients in that area and preventing them to have to travel into Antigonish, but also the ability to share and transfer patients back and forth to help even out the workload and the bed capacity. Similarly, in Canso, I think most people remember we had to unfortunately close the nighttime emergency department there a few years ago. And although we still are having some challenges with covering a few days of the emergency department, the nursing team has been stabilized there, and just recently in that community, working to see how we can maximize the ability to utilize that facility to its full extent. And then with Port Hawkesbury, Strait Richmond, we were down there last week for sort of the unveiling of the ambulatory care and ED renovation. So some positive comments back from the staff there that it's a better working environment in relation to the physical layout. And so hopefully that'll help in relation to getting that emergency department and getting some recruitment there. I know one of the practice-ready assessment physicians will soon be ready to take on some more education in relation to being able to provide some emergency coverage there. So although it is difficult, we are trying to continue to look at recruitment and bringing people in. I believe there's another practice-ready assessment physician starting in that area, and hopefully we can start to build up that team, over the next year, which will help again alleviate some of the challenges that you're facing here in St. Martha's. And additionally, I think you would know that, Kathy Chisholm, who's the director and site lead, Dr. Tanya Sullivan, Dr. Amy Hendricks are all working collectively together around trying to ensure that, we do look at the other rural facilities and Antigonish more as a system versus individual sites, and trying to see if we can, again, maximize where patients are cared for, freeing up the regional site for those higher acuity patient needs, and just ongoing work in relation to system review, system performance, and outcomes. So if there's anything that you have as a staff or a team that you want to provide us feedback or ideas, and certainly open to that. But we are working hard, and again, to Minister Thompson's comments, there are some additional health assets coming, and hopefully that'll help alleviate some of the pressure from the emergency departments. So you're dealing with more, absolute emergency needs versus maybe primary care needs.
Thank you. I think I'm going to ask another question from the submitted questions, and then I'll get, if that's okay. So the next question is around accessibility. Why doesn't the town of Antigonish have affordable and accessible group homes for physically disabled people? Why doesn't the town of Antigonish have affordable and accessible assisted living facilities?
So this is one, if whoever put in that question, if they're here, I'd be happy to have a quick discussion with them offline. Really, we need to connect with our colleagues at the Department of Community Services on that particular question, and I just want to make sure that we're giving you accurate information. So I will come back. I apologize that I don't have it with me right now.
What I will say is that seniors in long-term care is looking at the range of services that are available in community. So we know that there are folks who can live independently or get home care services, and then there's also long-term care facilities, and there is a bit of a gap in terms of living in supportive housing. And so sometimes that sits with Department of Community Services, and then sometimes that sits with health. And so we're just really trying to understand how best to support folks to live in community, because we know that that's where people want to be. And so that is, I don't know if there's anyone at continuing care that has anything they want to add back there. You can just say no if not, but I don't want to put them on the spot. But I just want you to know that we are aware, and we hear in communities that folks want a different option. And so I know that continuing care or seniors long-term care is looking at what are the options that may be available to us. Again, around workforce would be one of the things that we would be concerned about. How do we develop a workforce that's ready to be able to do that? And making sure that we have primary care available so that folks are supported if they have an episodic health care in their home. So I think there's more to say about that. It is on the radar, and we'll see if we can get more concrete information about that.
Great, thank you. So we have a question in the front here.
Hi, just to let you know, I am a recently retired nurse, and the reapplication process is painful. So, but I also want to know if there's any plans for a possibly walk-in clinic or something like that in this area. I know in the Cape Breton area, there's quite a few there, and it's something that's really lacking here.
So I'll start, and you can correct me or fill me in or whatever, fill in the group. So we are looking, and I think Brett will be able to give you some more information about what's future facing in terms. We know that there's a gap around like that urgent care, not just like the after hours clinic, but on weekends as well. And they did exist pre-COVID. So my understanding of that clinic. So even though we do pay physicians through contractual agreements and things, we don't actually mandate how they are independent practitioners. And so folks worked out of that clinic, as a practice team, and that practice team for a variety of reasons has changed. So moving forward, we know that that's a gap. I hear about that a fair amount in my office. That's probably the single most common thing we hear about: when are you getting an after hours clinic? So it is on the radar. We are working. Nova Scotia Health is working with local practitioners. I don't know that it's going to be immediate. Do you have anything you want to add? But it is on the radar, and we know that people need different options after hours and on weekends, and we're trying to understand how we can deliver that with the practitioners that we have.
So I'm not going to pretend to be an expert in every field here, so I'm going to call on Michelle De Potesta or Sarah O'Brien if they want to speak to just primary care here locally. I know some general comments about it, but I'd rather maybe have the director, executive director speak to it.
Yeah,
Come up here so everybody can see you.
Sure.
Share the limelight.
Yeah, thanks, Brett. Speak to you after hours here in Antigonish. So I know we did have a really high functioning after hours clinic pre-COVID, and it was very well utilized and definitely filled a gap. And I think as we're all feeling some of these retirements coming upon us now and into the next, I think, 12 months, it tends to be even more pressured. So acknowledge that. I think to Michelle's point, the after hours that was ran pre-COVID was an independent physician group. And as we start to kind of look at identifying our gaps,
that health human resources and those physician resources, or those hours that we're really trying to figure out how can we enhance access for the community and how can we work with them to ensure we have a model that does that. So right now, it's on our radar. We're looking at what the future can bring in terms of Antigonish, and we're really have an excellent physician engagement group. We've been meeting with all of our physicians and really trying to explore what can we do into the future. We do have our primary care clinic that just opened in June, and we've really created some excellent pathways with virtual care in Nova Scotia to try to enhance access. So, and also working with the ED and trying to ensure that, you know, we're seeing the people in the right place at the right time, and we're utilizing resources in that way. So no immediate solutions in terms of after hours, but what I will say is that we have some excellent engagement and collaborations and conversations, and how can we ensure effective planning for the near and immediate future.
So it is on the radar, and we're trying to see what we can do. And to your point about on like re-engaging, we know, we hear again and again about what's involved in coming back into the system or getting into the system, period, right? So that's very, we've been working through streamlining those processes, understanding what the gap is, getting people back in so that there's not this constant churn of vacancies. Yeah.
Having local HR would be helpful.
Yeah.
And I just want to add to that I think this is a great question to have raised, because it gets us into a number of different areas. And I think one of them is that, like, recognizing and that it's on the radar about after hours, but I think it's also part of the discussion about doing things differently as well, and ensuring that people have access. So it might not be the exact same way you used to access services, but you still have access. And so that's part of the bigger conversation that we need to have, right? Is about how do we get you the best access, just might not be the same as you used to get it.
Just one question. Is it on Nova Scotia Health, like entering in through our recruitment, or is it with the college? It's with Nova Scotia Health. Okay.
Okay, we have a question up here, and just before we take that, I would say that one of the submitted questions was actually almost exactly the same as that question, so thank you. Yeah, that's over.
Hi, yeah, that's why I'm here today, about the access to the after-hours clinic. It was right around the corner here. I used it a lot. My children used it a lot, my grandchildren. I thought it was wonderful. You speak about a physician. Does it have to be a physician or a nurse practitioner at these clinics? Like, can we use that?
Yeah, it can be either. I think we need a primary care provider, is what I would say, and just again trying to make sure that when we increase access at a different time of day, we don't lose it, right? So it is around adding, in some cases, adding people to as providers in the community, which is important. But it does need to be either a physician or a nurse practitioner, and then who supports them. You know, like maybe there are other people that could work, like a family practice nurse, as an example, who can really, use their scope to the highest ability, freeing up physicians and nurse practitioners to do more acute or different things around diagnosis and treatment. So. Scope of practice has been a really big focus for us, making sure that people are using the skills that they have, and wherever we can, pushing them. Like an example, I'll give you an example, is Lyme disease. So if you find a tick, typically, often people would present an emerge and say, I have a tick bite, or here's the tick, or whatever. But in fact, pharmacists can now look at the tick. You take it with you, you look at it, they will bring it, they'll do an assessment, and then if you fall within that assessment category, they can actually treat you so that you can get a preventative dose of antibiotics, and the assessment is free. The antibiotic is nominal. It's an old antibiotic, and it's very inexpensive, and so that can be done, and you don't need to go to the emergency room and wait to find out that it isn't a black-legged tick, to find out that it's a different kind of tick, and you waited 10 hours to find out that you don't need treatment or whatever. So those are just some of the ways that we're trying to expand people's scope and give them access for different things. So that would, it's really important that we use people's skills to the highest and best of their ability, and we haven't always done that. And I know it feels like everything's planning, but there's just not one way. It's like a spider's web. And so we need to keep moving all of these different things forward in order for us to kind of, move and advance healthcare forward. And so it's not a magic wand, but I can tell you that really looking at trying to do things differently and connect dots in a different way so that people can have access in a variety of ways. My son is 20. He doesn't really want to go and see the physician. He'd rather do virtual care, right? Whereas some of us, I'd rather go and see my physician if I had, 15 or 20 minutes or, of their time. So just trying to give people options so that they can access care in the way that is the best that suits their need at the time.
And then I think on that too, then making sure that people understand their pathway, right? It's about, the minister's comments on scope of practice are excellent. We haven't always been great at communicating to you how you actually get to those services or where they are. So that's something else that we're taking into consideration as we look at the various options, is making sure that you as community know how to access things in your community, which might not be the same as in the next community, but that you have all the information that you need to be able to fully access the services you have in your community.
Just on that point, how do we know what we can, how do we know what the pharmacy can offer to us? Like, if I had a tick, I wouldn't have thought to go to a drugstore. So where is it sort of the information, these certain things can be dealt with through a pharmacy?
I think we can have a look. I think the Pharmacy Association in Nova Scotia would be one place to look at that. And I think really for those of you that have the pharmacy, most of us have a pharmacy and a pharmacist that we spend a lot of time with, I would ask around those things, what are the things, so one is the vaccination as an example, right? They've been terrific partners in terms of how we rolled out COVID vaccines with Department of Health. And some of them have different levels of training. So I think, and I don't want to put them on the spot, that they would tell you what services they have available there, because there may be some little differences. Some pharmacists were trained to give babies needles, as an example, whereas maybe there would be other pharmacists that didn't, they chose not to do that. So what I would encourage people is to talk to your pharmacist. Urinary tract infections, as an example, that may be something that you're able to go and see your pharmacist about. Most can train for that. Some prescription renewals can happen there. Birth control referrals as an example, refills as an example. So each pharmacist can talk to you a little bit about the scope, especially if you've been there for a long time. You may be able to do some of those things, but definitely Lyme is one of the things that they can prevent now.
Okay, thank you. I have another submitted question. It's kind of the tail end of, there's a question around collaborative and community healthcare centers, but I think we covered a lot of that. But there was another piece that talked about the government working to adopt harm reduction practices within mental health and addiction services within Nova Scotia Health.
So I'm going to defer to my mental health and addictions leadership in the back there. So Nadine, I'm not sure if you want to take that question, please.
Hi, thank you for the question. Certainly adopting harm reduction as a philosophy of care is certainly very important to us as a program of care and a provincial program of care across the province. And I think that's the lens that we are bringing forward in all of the programs and services that we're standing up, in terms of, similar to, we hear that phrase, the right service at the right time for the individual. For us, it's really about that person-centered care and having that individual and their families be at the center of what's provided. And so harm reduction, absolutely. Standing up our recovery support hubs is an example of that as well, in terms of knowing that we need to decrease the barriers to access, but being open to meeting people where they are, and having a whole continuum of services that will be suited to those individuals, regardless of where they are within their journey in recovery within mental health and addiction. So I would say in all of our programs and services, harm reduction would be at the center in terms of adopting that philosophy of care throughout.
Thank you, Nadine.
Thank you. Are there any other questions from the? I have one last question on my my pre-submitted questions. Oh, look, now we've got a couple. So yes, I've got.
I just wanted to follow up to Terry's question before about the pharmacy.
Okay, Mike.
What pharmacists can do. I have a question about them accessing your blood tests. For example, if you have low potassium, you go for blood tests. Do you have to contact your doctor to find out what your test results are, or can your pharmacist say, oh, we can check that for you. You don't need that prescription any longer. Your potassium level is now fine. Is that something that is considered within the realm or authority or parameters of a pharmacist? Accessing specific.
So I'm going to tell you as a nurse what I think of that, and we'll get you the exact answer. But I think what I would say is it depends. So there is a program where people that are outside of NSH can access, like I know at the long-term care facility where I worked as an example, we could through a process have access to diagnostic imaging and blood results. So I think it would depend on the reason your potassium as an example was low, and if that was related to another medication that you were on, or it's not as simple, I think, as that. That's why I think it's really important when we look at pharmacists, kind of how long you've known them and you've been working with your primary care provider and that person. As an example, some pharmacists are able to help people with their INRs, right? So people that take blood thinning medication. So it is a bit person specific is what I would say. They would not be a typical provider that we would go to for low potassium, right? We need to understand that in the context of your health care system, and that would be worked out with the physician. So I think there's a nuance there. I don't know if they have access to share on a regular. No. Do you know? I think we'd have to find out how they access or if they're able to access those on a regular basis. It's my understanding, and there's some docs in the room that might be able to tell us about this, but I don't think they can order tests yet either, right? So that's, yeah.
Actually, I was just going to ask Kathleen, I was just wondering if you wouldn't mind saying a few words, just about, just about overall scope of practice for the pharmacists and what folks might be able to access through that avenue.
Perfect.
This is Kathleen Coleman. She's our Executive Director of Pharmaceutical Services in the Department of Health and Wellness.
And hi, everybody, and thanks for having us here today in Antigonish. I think the minister is correct. It depends. You know, if that lab is related to monitoring drug therapy, then your pharmacist could be the appropriate person to go to. But their scope is within the realm of managing your drug therapy. They're not going to be discussing other labs with you, and that wouldn't be their role. But pharmacists do have access to share from their pharmacies. So certainly if it's related to your drug therapy, the pharmacist may be the person you think to go to first, finding that right path to care. Doesn't mean you wouldn't necessarily follow up with your GP or your nurse practitioner as well, but you could certainly be connecting with your pharmacy when it's related to drug therapy management. And it's correct, they can't order labs yet, but they can view the results of the labs. So, yeah.
Thanks, Kathleen. I didn't know you were here, sorry. I wouldn't have muddled through that. I know I wouldn't muddle through that on my own.
Thank you. We had another question ahead there. Thank you.
Thank you. Hi there. You had mentioned earlier about the retirement of Michelle Murphy and the upcoming retirement of a number of physicians with very large practices. I wonder if you could update us today as to how the recruitment is going for those particular practices.
We have that. Just give me 1 second.
Yeah, it's not. I guess the response isn't just specific to family practice physicians, but I can give you an update. So there's a number of physicians that we've been looking at in relation to hospitalist coverage. So that's physicians that we're looking to recruit to take care of patients that are inpatients within St. Martha's specifically. So there's two physicians, just one determining on timeline when they can arrive. There's another person of interest in relation to U.S. resident who's interested in coming. We have a new plastic surgeon who's signed an offer, but I always like to say we don't confirm 100% until we can see them in person. But so that's promising to have support for Dr. Mike Brennan. We have another physician who's just signed a letter for family medicine in Antigonish. So that's just as of late. And we have an offer in relation to a pediatric physician. So, you know, the physician recruitment is ongoing. I'm not sure if we fully understand yet what the full patient panels are in relation to all those physicians. So I think that's something that, you know, medical affairs within Nova Scotia Health and Department of Health are looking at to see determination of what the replacement would be in relation to that. Certainly wouldn't be a reduction, but trying to understand what the panel size is, and then is it just physician replacement, or is it nurse practitioners, family practice nurse? How do we bring other providers in around those physician collaboratives to see if they can increase and bolster the amount of patients that they can cover?
And I think for those of us, like the way we talk about like the past is not the future, really, right? So those physicians that we had years ago that, saw you everywhere. They saw you in their office, they saw you at Emerge, they saw you in the hospital, they delivered your babies. Like those docs it's a very different way now that physicians practice medicine, is what I would say. It just starts really at the schools, right, where they're learning medicine. So we may have a physician that's nearing the end of their career that have worked for 40 years that have, 2,000 patients or 2,500 patients or more, but new physicians don't work in quite the same way. They want to practice in a team environment. And so it isn't one for one anymore, is what I would say, which also kind of adds to, some of the recruitment challenges. But I do want you to know that in Nova Scotia, we do have the highest number of physicians per capita than any other province, and we also have the highest number of specialists per capita. So we're trying to understand where can we support those physicians in terms of taking on more patients, right, and supporting them with a team. So nurse practitioner, wherever possible, family practice nurses, different dietitians, physios, all of these different folks, so that you are attached actually to a clinic, like those old days of this is my doctor will hopefully and likely become this is my team. And so I may not see my physician or nurse practitioner today, but I may see the dietitian today, or I may see, the family practice nurse today, or whatever. So this is the new team-based approach, and we are looking at developing that so it maximizes everybody's scope and it allows us to bring in more people into the practice. And it creates access, right, for folks in a different way. So we are very aware. We have a lot of docs in the province who are near retirement, and we're trying to get a handle on that. Again, independent business owners, many, and they don't want to tell people right off the bat. It causes a lot of distress when they're ready to retire. And so we're trying to work with physicians to say, how can you ease out, and we'll ease somebody new in, because that's the other thing. New docs need time to get to know their patients and panel up. So there is, we're well aware. We've been sounding the alarm.
Are you looking at establishing a collaborative practice like that in the Antigonish area or in Guysborough?
That is being looked at, yes, yeah. So that would be Sarah O'Brien and the team working with the physicians to see what we can come up with in relation to supporting them and providing coverage. Just I did miss that there was a practice prep physician who just started in October as well in Antigonish. So again, just not looking at sort of the traditional physicians that come out of Dalhousie or other medical institutes in Canada, but looking at those international graduates to see if there's anything that we can support, and that's a person who's just come here. So again, looking not just in rural settings, but anywhere where we can have people come and support care.
The other thing that happens too is some of our GPs now, they want to do half-time in their office and then half-time maybe as a hospitalist or half-time in palliative care or oncology. So we're trying to also work and support those services as well so that people are a good match. And Sarah, I know I saw Sarah here. And so Sarah O'Toole is a local navigator that works. So it's one thing to attract the physician, but we have to also make sure that the family is a good fit and that this is seen as a really warm and welcoming place where you can, raise a family or your partner can be employed and all of those things. And Sarah's done a lot of really good work and very ingrained and involved in the community around how do we make sure that folks are a match. There's some very good teams. There's an excellent team in Pictou County as well that I know Sarah works closely with as well. So often there are teams that work in community that say, how do we bring people here? What are our assets? Taking these residents in, we're courting them now, right? That's really what's happening. We're courting people and really saying, like, look at all the wonderful things that we have here. And then we have some physician champions as well who have been amazing. So we have a lot of great things happening here, is what I would say. Sarah, do you want to say anything? Is there anything you want to share, or are you good?
Turn on the radio and hear me some other time.
Okay. But certainly, Sarah's, very involved in the community and very connected with Nova Scotia Health and understanding how we can support people and bring them here. Housing, as an example, is one of our challenges for sure. Yeah.
One of the other things that we're piloting to help new physicians in particular who are coming into practices through the Dalhousie School of Medicine, their family medicine clinic. We're piloting where new physicians will be working with the clinic, getting mentorship from the physicians who are there, building up their panel of patients. And then once they've reached their full panel of patients, then they will transition out into their own practice. And then we're looking at using that and seeing how that pilot works so that we can potentially try that in other locations as well, because it's for everybody, it's great for everyone, right? The new physician has some mentorship really close by. They have support as they're getting their practice underway, and then we can transition them off onto their own.
First of all, thank you to the Deputy Minister. I was chatting with you a little bit earlier about this. Thank you. So I work for the public library, and we're not a healthcare organization, but we are one of those community groups that helps a lot of other people access and navigate their health and wellness. So, for example, we've helped an awful lot of people book their COVID shots, and now I'm expecting a lot of people to come in and ask for help booking their flu shots. And also people learning how to sign up for virtual care. I guess I'm just wondering, and since we're actually, as a community group, we also work with a lot of folks experiencing homelessness and with various forms of mental illness. So I guess I'm just wondering if you've thought about ways to support community groups that are working to support our community members navigate health and wellness. And we actually used to have a partnership here with, I guess it was GASHA at the time, and it was something that, it can be done. So, thank you.
Yeah, so I'll start on this one. So we did chat a bit about this before the meeting started, but really what this falls into is in Action for Health, there's 6 solutions that are set out in the plan. And this is solution 6. And really it is about community wellness is what solution 6 is about. How we work in community, how we partner with community organizations, and really understanding what an individual community needs. Part of that work will be a development of a health equity framework, because we know there are some communities that are more marginalized than others as well. And so we want to make sure that we're reaching out to all of those communities and working with organizations like the libraries, like other not-for-profits, local things that might be in your community here, but not in others, and really understanding where our assets are throughout the entire province, and then leveraging those for the health and health promotion of all citizens. So really important organizations like yours. We had a bit of a chat, like we said, about helping people to navigate. We also know that some of the services that we're introducing, like virtual care in Nova Scotia as an example, that not everyone does have access to the internet, right? So our community organizations are very, very important to us in ensuring that everyone has access to those new services that we're entering into.
I would just like to add in, there is leadership at the site within St. Martha's and within the community. Mark Arsenault is here as a Director of Public Health, Sarah O'Brien with Primary Care, Kathy Chisholm is the site lead and director there. So there's a lot of connections here locally that if there's an opportunity for you to work with them across organizations to see what would be possible, and then certainly there's people here that you can connect with.
Are there any other questions from the group here? Like I said, I have one last question. I feel like this last question, it's not really holding it till the end. So if people have questions after, you can still ask that. So this is about maternal health. And the question is, how has maternal health improved over the years? And for what practices maintain low maternal mortality?
Yes, I'm not sure if Kathy Chisholm wants to comment. Certainly you have a midwife program here in Antigonish, St. Martha's, which is one of the programs within the province. I believe the other IWK and Yarmouth have the other programs, but certainly Kathy is helps to oversee with Ashley Cameron, who's the manager here locally. As I mentioned, we have a pediatrician who's coming in relation to solidifying the group there, so we should be good in relation to pediatric coverage. And we have, I believe, 4 OBGYN, Kathy, that help support women and children's health. So it's really a team approach here within St. Martha's, surrounding communities, Antigonish. But I'm not sure, Kathy, if you want to add anything else there.
Well, I do have some examples of some of the improvements that we have. Okay, sorry. I do have some examples of how we've measured some improvements. We've improved comorbidity throughout pregnancy by for people with diabetes and those types of chronic diseases. We've seen improvements. We have early referrals now to our support teams, such as social workers, dietitians, mental health. We've had enhanced home visitation now for children up to age 3. Practices that maintain our low maternity mortality. We do follow the Society of Obstetricians and Gynecologists of Canada guidelines, which are updated yearly, and are practices that we continue to follow. Our team at St. Martha's participates in the MOROB, which is Management of Obstetrical Risks Efficiently. That's a program that we've been using at St. Martha's since about 2010. Our team members participate in that, and we are bringing it to the Cape Breton Regional as of this year, coming year, 2023. We have engagement and participation in the reproductive care program in Nova Scotia, and we partner with them in reproductive care across the province.
Thanks, Kathy. Thanks.
Thanks, Kathy. That was great. So again, I feel like this auctioneer that's doing this. Are there any other questions? Oh, yes. Oh, wait 1 second. We're just going to get you a mic.
I don't need a microphone. Anybody who ever taught next to my classroom would swear to that. I guess I feel a bit guilty because one of my questions was already asked, but it's a follow-up to the VON question. And I know the VON is currently trying to raise money to begin a digital progress reporting system that would save them enormous time. You know, how they write the reports as soon as they come and visit your house and stuff like that. And we got to know just about every one of the nurses because they came to our house for almost two years. I know locally that I'm involved with the credit union. We are making a substantial donation to their fund, but the digital transformation is very expensive, and I just thought that it would save time and allow them to do more visitations if the paperwork that they have to do after every visit could be just done with templates on their cell phones.
So digital transformation is really high on our list. There's nowhere that paper system doesn't touch, is what I would say. And so, like as an example, new physicians, they want a digital platform in order to care for their patients. We know that we're looking at one patient, one record, and how all of the different folks at like VON interchange and interact with them, so that we can have our information very readily available. And we were recently in Denmark, and every person over the age of 16 has an app on their phone, and their medical record is on their phone. And that was mind-blowing to me that they could have that, and they've had it for a long, long time. So digital transformation is really an important aspect of where we're going, and to your point, it saves so much time and it creates efficiencies. And so there's a number of things that are happening in digital services and across government as well. Like there's so much information that different parts of the government have that doesn't necessarily talk to one another. So I can assure you that that is a priority for us to look at. And when I say, like, I don't want to be too partisan here, but the Premier, the grass doesn't grow under his feet. So when I talk about the pace, like if he if he says it, he wants it done. And so we've been working very, very hard over the last year to keep up and also to progress and move things forward. And so I just want to assure you that that is on the top, top of our list, and digitalization is a key part of our health system transformation. Yeah.
Thank you. Just doing my final little look around. If there's anybody that's been holding back and really wants to ask a question, it's a great opportunity. And if not, I'm going to pass it back over to Ken, and he'll have some closing comments.
Thank you very much. Minister Thompson, thank you for being here today. Deputy Minister Lagassé, and certainly Mr. McDougall as well. I'd like to also thank all of you in attendance here this afternoon for helping the panel here have this meeting in a manner in which we are accustomed to in this community. It's been very warm, and there's been some great questions here asked this afternoon, and we'd like to thank you all for your participation, and safe travels.